Hi friends, today we are discussing lateral medullary syndrome. I remember a teacher in his 60s presented with difficulty in walking with no coordination in right limb. In other words, there was no control and no organization of upper and lower limb on right side. As the time progressed, patient developed nausea, hiccups. Eventually, he developed difficulty in speech. There was history of diabetes and hypertension. On examination, patient has a nasal speech.
Cha. Cha. Cha.
In nasal speech, the passage of a column of air is moving from larynx, pharynx and nose. Examination of eyes shows that there was drooping of right eyelid. Patient is not responding to open the right eyelid. Left pupil in dim light was dilating, but there was failure of right pupil to dilate. General physical examination shows loss of pain and temperature on right face and loss of pain and temperature on left upper and lower limbs. Examination of oral cavity shows impairment of right soft palate. Here is MRI of axial section of skull passing through medulla oblongata. It shows an pale area, of infarction on right side of the medulla oblongata. To summarize, patient presented with difficulty in walking, speaking and swallowing. On examination, there was failure to dilate the pupil on right side and loss of pain and temperature on right side of the face. But there was loss of pain and temperature on left side of upper and lower limb. The probable diagnosis of lateral medullary syndrome was made and was confirmed by MRI. Let us analyze what made us to arrive at diagnosis of lateral medullary syndrome. For that, we need to define the objectives of the video. They are: 1. Who has framed 4 rules to diagnose brainstem anatomy and vascular syndrome? Which manifestation of syndrome suggests that the syndrome is 1 from medulla oblongata and 2 from lateral part of medulla oblongata? Next objective is: which is the main artery involved in lateral medullary syndrome? Friends, rules of 4 were framed by Dr. Peter Gates, the Australian neurologist, to diagnose the brainstem anatomy and brainstem vascular syndrome. Friends, first rule of Peter Gates states that the last 4 cranial nerves are present in medulla oblongata. They are 9th nerve, that is the glossopharyngeal nerve, the 10th nerve, the vagus nerve, the 11th nerve, the spinal root of axis nerve. All these 3 cranial nerves emerge from post-oleosulcus. The hypoglossal nerve emerged from pre-oleosulcus. Friends, the second rule of Peter Gates states that motor nuclei that do not divide equally into 12 are situated in lateral part of medulla oblongata. They are nuclei of 9th and 11th. Nucleus ambiguous is the nucleus of these nerves. Here is an image of transverse section of medulla oblongata at the inferior olivary nucleus. It displays nucleus ambiguous. The nucleus ambiguous is responsible for swallowing and speaking. The image shows nasopharynx, oropharynx and laryngopharynx, the areas innervated by nucleus ambiguous. Fourth rule of Peter Gates states that there are 4 columns present in lateral part of medulla oblongata and these are affected. The names of the columns start with the letter S. Here is an image of transverse section of medulla oblongata at the inferior olivary nucleus. It shows first column that starts with the letter S is spinocerebellar tract. Lesion of this tract results in loss of gait on the side of lesion. The video of ataxia is displayed to demonstrate the effect of lesion of spinocerebellar tract.
Not gonna have
Difficulty walking.
The second column starts with the letter S, and that is spinothalamic tract. Lesion of this column results in loss of pain and temperature on opposite side of body, that is upper and lower limb. The third column starting with the letter S is sensory nucleus of trigeminal nerve. Lesion of this tract results in loss of pain and temperature on the same side of the face. The fourth column starting with the letter S is sympathetic fibers. These are descending fibers. Lesion of these fibers result in partial ptosis, that is drooping of the eyelid, meiosis, small pupil, and anhidrosis, that is a loss of sweating on the same side. Friends, one more symptoms of lateral medullary syndrome is vertigo. It is due to the vestibulocerebellar tract. Next slide, we are watching the animation of arteries. The right and left vertebral arteries unite and form basilar artery. The basilar artery continues in anterior median fissure up to the upper border of pons. Each vertebral artery gives a branch commonly called as Pica, which is an expansion of posterior inferior cerebellar artery. It is the main artery supplying lateral part of medulla oblongata. Blockage of this artery results into lateral medullary syndrome. Now, here we go. Now let us summarize in one punch line which reminds us gist of lateral medullary syndrome. We take the help of our beloved friend Pikachu. Pikachu, I can't chew.
Pikachu!
Pikachu, I can't chew. 4S.
We have seen in previous slide the first word of Pikachu. It is a Pica. It is an abbreviation of posterior inferior cerebellar artery, the main artery causing lateral medullary syndrome. The word can't chew represents patient of lateral medullary syndrome can't swallow. The word 4S signifies injury to four lateral columns starting with the letter S. They are spinocerebellar. The other columns are spinothalamic, spinal nucleus of trigeminal nerve, and descending sympathetic fibers. By the slogan Pikachu, I can't chew 4S, I am concluding the video. I am excited to come with the next video. Please subscribe Kazi Magic, hit the bell icon, like and share. Thank you for watching. You can visit www.kazimedicalclasses.com